So I'm here at Seaside today to do an online consult with one of our clients, Tina. Say hi to everyone, Tina.
Hi.
Hopefully this will give you an idea of what we're able to accomplish by having our FaceTime consultation with you. So Tina, I am going to be asking you a few questions to see if we can identify what concerns you might have or what problems that you would like to have addressed. And then we'll go through and we'll come up with a treatment plan that will be available here. I'll be completing that and then scanning it into your chart. And then you will have an opportunity to go online and purchase any of the products that we discussed that you're interested in purchasing, so that as soon as Seaside reopens, you'll be able to come in and get quickly taken care of. Okay, so Tina, why don't you share with me the concerns that are bothering you right now? Just to let you know, when I'm looking at you, I'm seeing a beautiful face that I know matches the person you are on the inside. And so my goal in working with you today is going to be to address some of those problems so that we see that radiant inner self shine out.
Okay, great. Thank you. So for me, mainly, of course, I want to age gracefully. I don't want to look like I'm 20, but as I am getting older, there are certain areas that seem to bother me, and sometimes I'll look, especially in the mirror, and I feel like I look a little more tired than I should. So the areas that I see that bother me the most, I kind of have some strong lines here naturally, and as I get older, I feel like those get a little bit more pronounced and going around the mouth area a little bit too. I just feel like I also have really kind of these little areas here. And then the only other area that I would love to see look a little bit more full, I naturally have smaller lips, but just on the top, my top lip, I just feel like it's just disappearing as I get older, so I would love maybe a little more fullness right there.
Okay, great. So why don't we address the concerns in the order that you outline them for me? And I would agree with you, the nasal labial folds, which are the area right in here, do seem to be rather heavy. And an old way of thinking about treatment for that used to be that we would fill in that area with a filler in the folds. And sometimes we still do need to do that. But for you, what I would recommend is our cheek filler called Voluma. And it's a very heavy, durable filler that I call it the infrastructure filler. It helps to create the support system in your face. So I'm going to show you on me what it would look like if we were using this filler. In a normal consultation, I would show you on you, but I think you'll still get the same idea. So rather than filling in this area here, by placing filler in the cheekbones, we are actually lifting and creating a nice support structure to hold that cheek up so that it's not falling forward. So if you take your hand and do what I'm doing and lift on one side, go ahead and pull back a little, you see what a difference it makes in terms of softening the folds there.
Oh, yeah.
So in your case, I would recommend 2 syringes of Voluma for that problem area, 1 on each side. All right, so as we do start to age, we lose a lot of volume in our face. We don't have as much collagen anymore, and so that's why you're seeing these areas of depression here, often called the marionettes. And then we also have a little bit of sagging at the skin and a loss of support called our jowls. So to deal with that lower face volume, we have great fillers from the Allergan product line called Juvederm. And so in your lower face, I would actually place probably a half syringe on each side, if you can see the area that I'm pointing to. I would place a little bit deeply, and then I would use a cannula to go ahead and fan it in there. And what that does is it pops and replaces that volume that's missing. And one of the things that happens with lost volume is we get shadows where we don't want them to be in our face. We want light reflection, and so bringing that skin back to baseline helps take away those dark shadows that are aging you. Okay, and then finally, to address that jawline issue where the jowl is falling forward, sometimes people say, well, if it's heavy there, why would you use filler? But filler is actually a great tool to give us the opportunity to create contours. So by using a cannula, we can place Juvederm along your jawline here and fill in the areas of deficit so you get the illusion of a straight line, which is much more flattering. And then we can also place filler back here at the jawline to get a little retraction on your skin. So for you, I would recommend 1 syringe of Juvederm on each side, placed with a cannula in order to correct the deficiency, and then use a needle to place a little bit back on the jawline. And the last area to address, which is one of my favorite areas, and I think all of the injectors here at Seaside, is the lips. And you've done a very good self-assessment. You have good volume to your bottom lip. What I would like you to do is do a kissing motion for me and then turn your head to the side. And just move the camera a little so I can see it better. Perfect. And a little towards me. Turn a little more, a little more, a little more. Okay, relax and face forward. So one of the things that we're seeing is you're getting good projection on your bottom lip, which is nice, and you have nice fullness, but you have asymmetry in your top lip, and you could definitely handle volume in that top lip as well. And one of the things that happens as we age is this area between our nose and our lip gets longer and heavier, and our upper lip thins, so it starts to disappear. For that top lip, we would use a pillar technique that would help to draw that lip up. And I wouldn't use a super heavy product on you. I would use a medium product because you don't need a ton of volume, but you do need some volume and you need lifting in that lip. So 1 syringe of Juvederm is what I would recommend for that, and I would pick the product when I see your lips actually in person. Okay, so I'm going to summarize for Tina everything that we talked about, and I have her treatment plan available here that will get scanned into the computer. So Tina, we talked about doing 2 syringes of Voluma to get those cheeks nice and lifted, give you some definition, and eliminate your folds. We talked about 1 syringe split to the marionettes area. We talked about 1 syringe on each side for the jawline, and then we talked about 1 syringe for the lip. So you might say to me, oh my goodness, how am I going to do all that? What's going to happen? Well, one thing I want to assure you is this is a treatment plan. We can look at this as a map for the trip that you're about to go on. Some people want to fly first class, get there immediately, have it all done at once. I am happy to make that happen. That appointment might last an hour and a half to 2 hours. Or we can stage by priority what's bothering you. That may work with your timeline. It may also work with your checkbook, if anybody uses a checkbook anymore. The nice thing about working with clients at Seaside is that we really want to cater to your needs. We're looking for a long-term relationship. We want to be here to hold your hand and walk you through this journey of being new to filler and treatments that can be done here at Seaside. So let me ask you, I'm sure there are many questions racing through your mind right now, so go ahead and feel free to ask.
My first question would be, how long, if I decided to do everything, what would be how long would the results last, what do you think?
So different fillers last for different periods of time. What you can expect with the cheek filler, since it's very durable, is about an 18-month window. For some people a little shorter, for other people a little bit longer. The other fillers that we're looking at are a window of about a year. And again, some people shorter, some people longer. We find people who are vigorous workout fanatics do tend to go through their filler a little bit faster. And then it varies by individual.
So what is the pain level like when you actually get the injections? And is there any numbing? And what's the downtime after?
So most people do really well with their injections. I think fear is a big factor. So just to let you know, we do numb ahead of time, and that would be for areas that we're going to inject using the needle. The cheekbone doesn't usually require any. We don't have a lot of nerves as we move out in the cheek area. In the rest of the mid-face, if we're using a cannula, we'll do a local anesthetic. And we use a numbing cream to prep you about 30 minutes before your procedures for the low face treatment. Lips, I recommend 45 minutes of numbing. It makes a big difference. What
should I expect for the downtime, and what is the aftercare?
Okay, so that's a great question, and you actually can have a big role in affecting downtime. So you're going to get a set of instructions emailed to you before your appointment, and those are all things that can lead to bruising, which is the biggest problem that causes downtime with filler. So if we can get you to avoid any aspirin, any Advil, Motrin, vitamin E, fish oil, and alcohol for a minimum of 5 days prior to the treatment. I know we've all been taking a lot of alcohol in these days, but prior to your treatment, it will go a long way in preventing your blood from thinning, which then places you at greater risk for bruising. So as far as downtime goes, as we mentioned, the biggest risk is bruising. And so cover-up makeup could be important, although the majority of our clients actually don't bruise as long as they follow our pre-care instructions. The most important aftercare is you cannot wear makeup for 24 hours after the treatment. We've gone through your skin with a needle and created a portal for bacteria to enter, and we want that to heal completely. And putting makeup on where our dirty fingers have been is going to be something that can create problems. So by following our instructions, you should have no complications and be able to really enjoy the benefits of your filler very quickly. So Tina, today we just talked about filler since that was your primary interest, but I did want to let you know that at Seaside we do Botox. We have a full spectrum of lasers for skincare issues, and I really love for all my clients to at least make a consultation with our estheticians because they really, really do an amazing job. They've done a great job with my skin in the 3.5 years that I've been at Seaside, and so I just encourage people to take advantage of that opportunity as well.